Yeah.
Well, Dr. Tantillo, I'm going to call you Mike for the remainder of our interaction here because we are now friends. I'm so excited about talking to you because for me, and I know so many other people, talking to a plastic surgeon is not an everyday thing, but we have so many questions.
Yes, and hopefully we have so many answers.
Excellent. Well, thank you for taking the time today. I start these conversations with a very simple question. And of course, your topic is like the poster child for why does plastic surgery and even the notion of getting something done throws us into this tizzy spin of should I, could I, must I, do I? So when people come to you, are they already kind of crossed that confidence chasm? Are they convinced they need it, or what is the confidence issue?
Yeah. So, not everyone has jumped to that chasm. I mean, people come in, they've obviously got, somebody they've come in, they've come in, they've made the appointment, they've come in, and, had a discussion, but there are people who are really coming in for information. They want to hear it, kind of directly from a surgeon. They've talked to their friends, they've looked at the internet and things like that. So there are plenty of people that are looking for information and come in and decide, well, maybe surgery's not right for them, or maybe not right at the right time, that particular time. Maybe they'll go home and say, well, I think I'm going to have children and maybe I'll wait. And then, of course, there are people who the surgeon, decides, not really good, maybe a lot of medical problems or maybe some expectations. So there is a first step there. But then, people are coming in and they want to kind of feel empowered, feel good about themselves. I mean, that's what they're coming in, one way or another that's the goal. That's the goal for them.
Right. So you and I talked before this interview, and one of the questions I threw at you was, somebody comes in and they're like, I'm going to get my lips done or my eyes fixed or whatever it is. And do they think that's the end all be all? Do they feel like that's going to fix all their problems? And if so, how do you deal with that?
How do you deal with that? No, that's exactly, the interview is definitely a two-way street. The consultation is a two-way street. And you're absolutely right. If a patient thinks that, one little thing is going to make all their problems go away, then, you really need to step back and say, we got to put this in perspective. Okay. Doing your lips, your eyes, whatever, it can help this particularly, if it helps the area, if it gives you some more confidence, makes you feel better, that's great. But if you think, all of a sudden, boom, your whole life is going to change, like you're going to win the lottery, then need to back up because, then the patient will have gone through a procedure and be disappointed.
Right. And it's not just a procedure. You mentioned that some of these recoveries are really significant. Yeah. You really have to be committed to go through it, right?
It's a big investment, and the investment varies a little, if it's a smaller procedure or a bigger procedure. But if you're talking about surgery, right, the investment is, the risk of the operation. The operations are low risk, but they have risk of the operation, the time out of work, the recovery, the financial investment. So there's a lot that goes into having cosmetic surgery.
All right. But in your experience, and you've been doing this for a really long time, I didn't read your bio because it's so impressive and so long, but it's on our post here. But you've been doing this for a really long time. You've seen and heard probably everything. Once a patient is really kind of like, yes, I want to do this. This is a problem area for me. I want to get this done. And subsequently, they go through the whole thing. They get through the recovery. What do you see? Do you see their confidence go up?
Yeah. So the initial recovery, the first few days, it's a little bit of an up and down, sort of feelings, good days, bad days. That's totally normal in the first couple of weeks. Then once patients have gotten beyond that initial recovery period, yeah, that the idea is that, hey, I feel good, I feel better. This area that I've been sort of thinking about a lot, that's been kind of giving me, making me self-conscious about either wearing, clothes or bikini or whatever it is. They're feeling good about it. They're feeling better.
Yeah, and my whole platform is about taking control of something, right? Whatever it is that's bugging you, or otherwise you feel like it's not quite where you want to be. Whatever that is, whether it's your financial health or in this case, your physical your outside well-being. So
Yeah.
I think just taking that step and saying, I'm going to do something about this, that's so empowering. Don't you agree?
Absolutely. Absolutely. I do. The taking the step to come in is a big step for sure.
All right, well, great. So one of the tips that I know you're going to talk about because of our preview example, though, is talking to somebody, but not just talking to anybody. There's a lot of people out there that will talk to you about getting a procedure and will do the procedure. So talk to me about how to find the right person. What does that mean to actually have that conversation?
Yeah. Yeah. So when patients are looking for people to do their surgery, they want to make sure that their physician, their surgeon is board certified in the specialty that they're interested in. So board certified in plastic surgery or board certified in facial plastic surgery, not a board certified something else who is doing some cosmetic surgery on the side, if you will. So that's really important, and it's a little bit of a buyer beware thing out there. And then when you have the procedure, if you decide to have the procedure, you want to make sure that the facility is fully accredited and there's a full anesthesia staff, because make no mistake, anesthesia is a very important component of the whole
every surgery. Right.
Yeah. So you want that component to be in place. But there's a lot of great very well qualified plastic surgeons out there.
Well, I keep wanting to do this as I'm talking to you, it's going to stretch my skin. But, one of the things that also I would think is, how do you guarantee, or is there things that you should ask to make sure that you don't look like some of the nightmare in Hollywood,
Right.
So give me another tip for if I were going to have that conversation with you or plastic surgery. What do I say? Don't make me look like Kenny Rogers, or I don't know.
Don't make you look like, nobody, I was going to say nobody. Well, Kenny Rogers probably likes looking like Kenny Rogers.
Yeah, for him, it's fine. I don't want to look like Kenny Rogers.
For him, it's good. So, it's funny. It's a low-tech, high-tech answer I've got for you. And the low-tech is probably the more important. And that is back to the conversation, back to the consultation. You as a patient, the patient wants to, get a sense of, do I trust this person? Is what this person is saying making sense to me? Does this person's aesthetic taste sort of jibe with mine? And you can get a little bit of sense of that from the view books, from the befores and afters. And really that, I think, is the larger component. Now, for some procedures, we do have 3D imaging and simulations and stuff like that. And so there are some procedures that, the patient could, we take the picture, we can simulate the result and give a sense of what he or she can expect.
That's great. So can I come to somebody like you and ask for that consultation and do all that 3D stuff before I even make a decision?
A decision about surgery? Oh, yeah. So the 3D simulation is typically part of the consultation. So you would come in and you'd visit with the surgeon, an examination would be done, and then all that would go into, the surgeon would put all that into the software to do the simulation. Yeah.
That's so cool. Oh my God, I might have to do that. We're going to have to talk.
Yeah.
Well, another last question on my list, and it goes to another, I guess, tip is, there's a Hollywood kind of mentality that, this plastic surgery is for the rich and famous and people who are always on interviewing camera and so forth. But I know you talk to normal people like me every day. So give me a profile, or is there a profile of the kind of patients that come and see you?
Yeah. So, most people are like most people, right? And so, and so most people who are having aesthetic or cosmetic surgery are they're not like, one end of the spectrum or another. They're normal everyday people that you run across in your professional life, your personal life, whatever. And as you had mentioned earlier, most people don't want to have this crazy Hollywood look. So, many people who've had cosmetic surgery, you wouldn't even know it,
Really?
People that you run into, you wouldn't know it. So, it's not out of reach for many people at all, in terms of, the results that can be obtained, even the financial commitment, which I'm not glossing over. There is a financial commitment, but even so, that is within reach of most normal, everyday people, so to speak.
You're saying I'm normal. I love you.
We're all normal. We're all our own brand of normal. That's what I say.
Well, I want to really thank you. I know you have a very busy schedule and you've got patients waiting to see you, and hopefully some of our viewers will be inspired to call and contact you. We'll have your information, of course, in our blog post. But thank you so much for your insight and giving us a little bit of a reality check on something that often seems like, kind of scary and out of reach for us normal people.
Well, it's been my pleasure. Thanks for talking with me.
All right. Take care. Have a good day.
You too. Bye-bye now.